Okay, this is part 2 of our videotape on the substance abuse management module, a harm reduction module, and let me pull up this slide. So SAM is a harm reduction model designed to teach participants to reduce the harm caused by their use of alcohol or drugs. It's not intended for physically addicted clients, more for abusing clients than for dependent clients. But Louise, maybe you could tell a little bit about some of the actual real harm that you see as a case manager.
Well, the concept of harm reduction is actually, a little foreign to a lot of people. That, you think of harm reduction, many people think of, the first thing that they could think of is like needle exchanges in Amsterdam. That, yes, is a form of a harm reduction where you're giving them a safe way to use the drugs. But what we're talking about certainly applies to everyday use. Some examples might be, let's see, medications. The example I gave on medications, where clients are told they're not supposed to be using substances when they're taking psychotropic medications. But guess what they do? They actually do. So what do you do as a clinician when you know that? A psychiatrist deals with this a lot. Do they still continue to prescribe a medication even though they know someone is using alcohol or another substance on it? And they do, because they find it to be safer to stay on medications but help the client learn how to reduce the amount that they're using and to not take drugs that actually interfere. Okay. That's harm reduction.
So let me go on a little bit. It's a real good example. So we already did that one. So let's go on a little bit here, and then we're going to show you actually some videotapes that are used in this training. SAM's goal is to rapidly reduce the harm of substance abuse with abstinence as the long-term goal. Motivation is desirable, but not a prerequisite towards participation in SAM training. In AAA, in AA programs, often they talk about bottoming out before you really make that turn towards your recovery. But what we find with people with serious mental illness, if our folks bottom out, they're already so close to a bottom that they don't almost even have a bottom to go to in terms of the amount of money they have, wouldn't you say?
Right.
So our system, as in the mental health system, we just can't sit by and watch somebody bottom out, because it means they're back in the hospital.
Right,
if they're
it's
lucky.
just far too high of a risk to have let somebody. That means psychiatric relapse in this context.
Right. Okay, so let's go on. So the key concepts of this model is that if you slip, quit early, which is called practicing damage control. So if you take a hit of a joint or you have one drink, quit early. When someone offers you drugs, say no, which involves escaping high-risk situations. Don't get into situations where you can't say no, so that's avoiding high-risk situations. And most importantly, do things that are fun and healthy, seek healthy pleasures. So this isn't one of those programs that just says just say no. It's say no to drugs and alcohol and yes to healthy pleasures, because there's an understanding with SAM that for a lot of our clients, substance use is pleasurable, involves pleasure, and we need to find some healthy pleasures. So we're going to go on to a couple more slides. The most important concept in SAM is called a U-turn. U-turns are alternatives to their steps in a drug habit chain of use, and U-turns decrease probability of use. And this next one is the key slide of all of the slides. On the one side, down on the lower left here, is a full-blown relapse, and on the right side is participating in healthy pleasures. The idea here, if a person starts moving towards the full-blown relapse and they're getting some warning signs, for example, it's approaching payday if they're doing some work, and payday has always been a sign that they may move towards using and spending the money on drugs, make a U-turn towards healthy pleasures. The next level is that if a person has gone past the warning sign and is now in a high-risk situation, is hanging out with friends who are, in fact, using or start to use, escape. And thirdly, if the person slips and they start to use, quit early. So that's the key, and this goes up on a board. So when you think of the 12-step program as 12 steps, well, this is the program for the substance abuse management module, the harm reduction module. So any comments on that, Louise?
Well, I mean, you're really teaching people skills to handle and to manage situations that you can pretty much predict people are going to get into. So it's understanding that and if they could just quit by going to AA and abstaining, they would have. If they're coming to you, it means they need some extra help in learning skills and in managing the situation. So this gives them some skills to do that.
So like, excuse me, I think I meant to go here. Like AA programs and other 12-step programs, they're ongoing. Well, SAM is ongoing too. There are meetings in SAM all through the week, but there are 3 different kinds of meetings. One kind of meeting is called basic training, and the assumption is when somebody attends these basic trainings, they may have no motivation whatsoever to reduce their use of substances. So basic training is about teaching people what for them are their high-risk situations and warning signs. It's really informational just to try to get folks interested in participating in the next step, which is skills training. Skills, as Louise mentioned, are some very specific behavioral skills that help you make those U-turns away from high-risk situations. Those are shown on videotapes, short videotape segments, several of these skills, and we'll show you those in our third and last segment of this. And then ongoing, there's something called practice sessions. Practice sessions, people who are in basic training go to the practice sessions. People who are in skills training go to the practice sessions. And folks who've graduated from basic and skills training go to practice sessions. Practice sessions is all talk about real-world events that are help people or stay with the healthy pleasures and move away from the unhealthy pleasures, and applying what is learned in basic training and in skills training. So practice sessions are ongoing in 2 or 3 times a week. 8 sessions of basic training, 27 sessions to get through the skills training.
Oh, okay.
It's very intense. There are 9 skills with 3 sessions each. So real quickly, just a few of the in basic training, it's really ideas and concepts more than skills. People learn what damage control is. They carry an emergency card, which helps them determine high-risk situations and warning signs and healthy pleasures and reasons they might want to quit drugs and how to manage their money around all of these issues. So that's the basic training sessions. The skills training sessions, there are 9 sessions down here, 1 through 9. And each one is practiced for at least 3 meetings in a group format. How to quit after slipping, how to report a slip to a trusted, like a sponsor, a trusted support person, refusing drugs offered by a dealer, refusing drugs offered by a friend or relative, getting an appointment with a busy person. Do you want
That's great.
That's a good one, right?
It's a very good skill to teach people.
Our clients, they are in a sort of a mesh of case managers and physicians, and a lot of times
when they need help, they need help now.
They do, and the frustration of even trying to get that help results in a lot of impulse to go for the unhealthy pleasures and to perhaps use. So getting a support person, finding essentially like an AA, a sponsor, similar, reporting symptoms and side effects of meds to a doctor, asking someone to join in a healthy pleasure, and negotiating money with a representative payee. Many of our clients, Louise, as you know, are on protective pay or somebody else is managing their money, folks with serious mental illness, and because of this reputation of somebody who's using substances, it's very hard for them to get the money they might need to join the YMCA.
Right, and do other healthy pleasures that would benefit them.
So there's actually a videotape. All these have videotape trainings and examples of how to negotiate and get the trust of your representative payee. And then finally, the last section here are those practice sessions. People talk about, did they encounter a high-risk situation? Are they anticipating a high-risk situation? Did they add a healthy habit or healthy pleasure? Are they anticipating adding a healthy habit or healthy pleasure? And what SAM skill can the people involved practice today that will support their ongoing success? So again, there are these 3 sessions, 3 different ones. Basic training is information. Skills training are videotaped and skills that are practiced, and practice sessions are applying those.
And a lot of nice interpersonal skills training that for people who don't have great interpersonal skills or have lost some of that, or who are not so assertive as somebody in the more normal population who can go to a high level meeting where people are at a pretty high, talking in a very high level. So teaching people these kind of assertiveness skills can go a long way in a lot of areas of their lives and a lot of people's lives. So it's very beneficial.
Okay, so now what we're going to do is end our second segment and go to a third segment. The third segment, we're actually going to show you the videotapes that are used to model these various skills. Quitting after a slip, refusing drugs offered by a family member or friend. And we think you'll find them very interesting. They're very short. So thank you, and the third section will be coming up momentarily.